Hello, Dr. Murali. What is cervical cancer, and may I know what are the causes for cervical cancer?
Cervical cancer is a cancer which arises from the lower part of the uterus. As you know that uterus is the reproductive organ, it has the lower part called the cervix. So a cancer arising from this is called the cervical cancer. Now, this was the leading cause for cancer in women for a long time. Until now, breast cancer is the most common in women. So even today, cervical cancer is a significant problem in most parts of our country. So this is a cancer which is purely caused by a virus. You have heard of various other causes for cancer like smoking and other factors. Now here is a cancer which is almost entirely, more than 99% cases, it is caused by a virus which is sexually transmitted. The virus is called Human Papillomavirus. In other words, it's called HPV virus. So this is a cancer primarily caused by a virus.
Doctor, what is the cervical cancer vaccine, and which are the vaccines that are available in India?
For long, we did not have effective preventive strategies for cervical cancer. All we had is a pap smear, that is taking a brush from the cervix and to see if there are any early trends of cancer. But now you can really start preventing this cancer from coming up. So prevention in the right direction, as I call. So just like you vaccinate the children against some of the common infections, this is a vaccine directly against the HPV, that is human papillomavirus. Basically, the body gets immunized against these viruses, which are called the HPV viruses. So basically, there are two types of vaccines that are available in our country at present. So the difference between these two vaccines are, one is effective against 2 strains of the virus, the other one is effective against the 4 strains of the virus. So these are the two vaccines currently available in India.
Doctor, how effective are these vaccines for cervical cancer?
As I said that the HPV virus is the cause for cervical cancer. So there are umpty number of strains under that virus which causes cervical cancer. To name a few, number 16, number 18, they are numbered. Number 16, 18, 35, for example. Now, 80% of these cancers are caused by two specific numbers called 16 and 18. Okay, 80% of the cervical cancers are caused by these two numbers, 16 and 18. Now, most of the vaccines cover these two strains, 16 and 18. So, if a cervical cancer is caused by these two strains of the HPV virus, it is 100% protective. So, but there is still a chance that even after taking vaccine, that individual can develop cervical cancer. So, at this point, vaccine is not 100% protective, but it is towards that. You can say they are 80 or 90% protective at this point of time. Yeah.
Doctor, till what age is this vaccine recommended?
This is a very important question. So many of the mothers, they actually come to the clinic and then ask, am I eligible for cervical cancer vaccine? Is my daughter eligible for a cervical cancer vaccine? So it is very clear that the best benefits of the vaccine is when it is given between the age of say 10 and 14 years. So that's when the best benefits are there. But then if there are no onset of sexual exposure, even up till 25 years is recommended. So the benefits of this vaccine beyond 25 years is questionable. So I would say that the best age is between 10 and 14, and then max up till 25 years you can think of giving this vaccine. And also another point is children require lesser dose. You can be done with just 2 doses of the vaccine. But if you're giving later, probably you may require 3 shots of the same vaccine.
Doctor, are there any side effects of this vaccine?
This is another common question women ask when they want to take this vaccine. One has to be very clear that this is just like another vaccine. Normally you give children many vaccines like hepatitis B virus and then measles, and so this is one such vaccine. Although there have been some reports of some adverse events, but then it has been eventually found that this is a safe vaccine. So another burning question people have is whether this vaccine causes infertility. So it has been proven beyond doubt that this vaccine doesn't have any such issues, and it is an extremely safe vaccine.